Good morning. Good morning, to you all. I'm Dee Taylor, the Community Development Associate with the Association of County Commissioners, and I have the pleasure of presenting this information to you this morning. So here are objectives for today's session. First, we'll do a quick recap of the basic threshold requirements that every project must meet under CDBGDR. Then we'll move into the tieback, which is a critical concept where each project must connect back to the disaster. And of course, in this case, it will be Tropical Storm Helene. We'll review HUD's three national objectives, low and moderate income benefit, urgent need, and slum and blight, and show how applicants can meet and document them. And then we'll cover the environmental review process, which is required before funds can be used for any physical work. We'll discuss duplication of benefits, which is making sure that federal funds don't pay for the same cost twice. We'll also talk about what counts as administrative planning and project delivery costs. And then, of course, at the end, I'll just provide points of contact, for your support. And finally, we'll share some additional resources to help you after this training. Now, of course, before we dive in, I want to take a moment to explain why today's training is important and how it connects to the bigger picture. I know some of you may be thinking, what, we've already covered some of this information. We covered tieback, national objectives in the last training. But today is about moving from that high-level overview and into a practical application. So here's why this session will help you. So the state will be assessing your project needs. And so by understanding HUD's requirements now, you'll be ready for that review, instead of scrambling later. So we'll go deeper into how to answer that big question: is my project eligible? And hopefully it'll help you make that determination and what documentation is expected. This training helps you start preparing early, helping you gather the right data, documentation, and evidence. All of that takes, time. If you wait until the application drops, it could put you behind. So this knowledge builds long-term capacity. So what you learn here applies not just to this round of CDBGDR, but to future recovery funds. But hopefully that won't be needed in the near future. So just a quick disclaimer. The scenarios and exercises you'll see are only examples to help explain key concepts. They are not final determinations. Every project will depend on the specific facts, the documentation you provide, and how well it aligns with HUD and state requirements. So ultimately, eligibility and funding decisions are made by the state, and your project must comply with HUD rules and the state's rules. So as you walk through these exercises, think of them as practice, not as guaranteed that your actual project will be approved. Now, some of you may be familiar with CDBG, but not as familiar with CDBG-DR. And here's just a simple way to think about the difference between CDBG and CDBG-DR. The regular CDBG program is pretty much an ongoing federal program that provides flexible funding for housing, infrastructure, economic development, public facilities. The main goal is to benefit low and moderate income people. And it comes in annual allocations. So on the other hand, CDBG-DR is more like supplemental. It only comes after a presidentially declared disaster, and it's designed to help communities recover and become more resilient. So with CDBG-DR, the key difference is tieback. So every funded activity must directly relate to the disaster that caused the funding. So while both programs share the same basic framework, CDBG-DR is more event-specific, recovery-focused, and has extra requirements pretty much tied to the disaster. So just a recap from session 1 training, we talked about the threshold requirements that every CDBG-DR project must meet in order to be eligible. So first, every project must have that documented tie back to the declared disaster. That means showing a clear link, either directly or indirectly, between the project and the impacts of the storm. Then second, the project must be located in a HUD and state identified most impacted and distressed area or mid area. These are the counties or zip codes specifically identified as being hardest hit by the disaster. And then third, the project must meet one of HUD's three national objectives, which includes benefiting low and moderate income persons, preventing or eliminating slum and blight, or meeting an urgent need. So all these requirements are the foundation. And in today's session, we're going to go deeper into how you document tie back, how to show compliance with a national objective, and how these requirements connect with the environmental review process and the other rules. So as you're thinking about tie back, remember there are two primary ways it can be documented, direct and indirect. Direct tie back means there is a clear documented connection between the damage caused by Tropical Storm Helene and the project you're proposing. So, for example, repairing flood damage to a road, that failed during the storm. So the documentation here will include things like damage assessments, engineering reports, photos, or insurance claims. Indirect tieback is a little different. It pretty much addresses vulnerabilities that became apparent because of the storm, or makes improvements to strengthen resilience for the future. So like upgrading infrastructure to prevent future flooding or strengthening facilities so they could withstand similar events in the future. So documentation might include mitigation plans, vulnerability studies, or again, assessments that recommends upgrades. So in short, direct is fixing what was damaged, while indirect is strengthening what was exposed as vulnerable. And just to give you an example, how project shows direct tieback, uh, this slide just demonstrates a multifamily rental complex that was substantially damaged by Tropical Storm Helene. Because the disaster directly destroyed housing, the tieback is straightforward. The project clearly replaces housing lost to the storm. And so the documentation is what's going to make the case strong, like FEMA records that will show that the property was damaged or destroyed. We also want before and after photos, if possible, inspection reports that prove units were declared uninhabitable. But the justification is simple. We're proposing to construct new multifamily units to replace those destroyed by the disaster. So this is just a textbook example of a direct tieback project. But the key takeaway is that if your project is replacing, repairing, rebuilding something that was damaged by the disaster, the tieback will be definitely clear and direct. You just have to gather the right documentation to prove that. And then an example of an indirect tieback, let's just say the same, an apartment complex, the building itself wasn't damaged directly by the tropical storm Helene, but the surrounding infrastructure was compromised and increased flooding risks, for the apartment. So in this case, a project to improve the infrastructure system could qualify as an indirect tieback because it addresses vulnerabilities revealed by the disaster and helps protect residents from the future. So this is a actual project that was funded in the past with CDBG-DR. And this project pretty much shows how the funds can be used indirectly to meet post-disaster housing needs, not just to repair the damaged, units. So the state invested CDBG-DR funds towards this project, multifamily development, to leverage other funding sources. And the development specifically targeted families earning 60% of the area median income. The site pretty much was chosen strategically, within within 1 mile of services, and pretty much just making it practical for displaced households. But the project relied on public and private partnerships, but it demonstrates how disaster recovery funds can address broader housing shortages and support resiliency and community development goals, in addition to direct rebuilding. Now, every activity must connect directly to the disaster impacts outlined in the state's action plan. So there's two paths: direct, which repair, replace what was damaged, and indirect, like I mentioned before, or resiliency, which addresses a weakness revealed by the disaster. The scope and location must be in a disaster impacted area unless the plan says otherwise. Document clearly and explain how the project ties to the disaster. And tieback is in addition to meeting a national objective. So weak, vague tieback equals high risk of, pretty much your application being rejected. And again, just some examples of documentation that you'll need, include things like maps, photos, and just any other kind of written justifications to document your tieback. And so how you can apply this to your project, first just confirm that your project falls within one of the action plan focus areas like multifamily housing, workforce housing, community infrastructure, or economic revitalization. Then next, just ask, can you clearly show either a direct tieback or indirect tieback? The documentation is very critical, to help strengthen your case. So make sure, you include, again, any maps, photos of official records, GIS data, but the bottom line is that the project must show where, how, and why it ties back to the disaster with evidence in the file. So let's talk about mitigation set aside as part of the CDBG-DR program. HUD requires that a specific portion of the funding be set aside for mitigation activities. So this means that a percentage of funds must go toward projects that reduce risk from future disasters and build long-term resilience. Now, these mitigation set-asides are not just about repairing what was damaged, but about making smarter investments such as strengthening infrastructure, hardening public facilities, improving stormwaters, or elevating housing. So when you're thinking about your potential projects, consider not only how they tie back to the storm, but also how they can address vulnerabilities that were exposed by the storm and reduce risk moving forward. So this set aside pretty much ensures we're not just rebuilding, but building stronger and safer communities in the future. And so now let's take a look at some of the examples of mitigation activities that can be funded under CDBG-DR. So for housing, mitigation can focus on making homes more resilient. For example, elevating substantially rehab homes or above the flood elevation. And the documentation here would be like engineering and design specification, flood maps, and just, cost estimates that highlight resilience feature. For infrastructure, if you're trying to strengthen your critical systems, the documentation again would be like your engineering studies, plans, and risk reduction models. For public facilities, we're talking about adapting facilities so they can function as safe havens, maybe during disasters. So for example, designing facilities with backup power, hardening schools or fire stations, and building resilient health clinics. The supporting documentation might include something like emergency operation plans or architectural drawings that show resilient design. So, and then for economic revitalization, mitigation can involve investment that keep businesses and community supply chains functioning after the disaster. So, for example, like retrofitting critical commercial spaces. But the documentation for this example could include like economic impact studies or local recovery strategies, continuity plans. But the key takeaway is that mitigation activities should reduce risk to future disasters, and strong documentation is very essential to demonstrate that resilience have been built into your project. So let's take a little break here and do an exercise related to a multi-purpose center with a occasional shelter use. We're going to use this as an example. So in this example, Cedar Ridge County is proposing to purchase and renovate an old commercial building in the downtown area. The building would primarily serve as a multi-purpose community center with meeting rooms, a computer lab, and event space. County officials note that during disasters, it could be converted into an emergency shelter. So the county's justification for CDBGDR funding is that the county has no other large indoor shelter space, and the building could house evacuees if needed in the future storms. The facility itself was not damaged during the storm, and the county did not open any shelters during Helene because the flooding did not require evacuations in that area. So the question is, does this project meet the CDBGDR tieback requirements? And so A, it does direct tieback because the county lacked shelter space during Helene. Is it B? Yes, indirect tieback if the county documents an unmet disaster-related need, or no, tieback cannot be established until actual disaster-related shelter need is proven, or D, yes, indirect tieback because the building could be used for future disasters. And if you are able to, you can put your answer in the chat. But if you guessed answer C, then you're correct. The tieback cannot be established unless actual disaster-related shelter need is proven. So basically, just saying that a shelter might be used is not enough. You know, the applicant must show residents were displaced and unmet shelter need existed. So without that proof, the project fails tieback. Now, if the data showed shelter shortages or something like that during the Helene, then it could qualify. You know, you could use maybe like emergency reports or after action reports, or like I said, a hazard mitigation plan maps, or any kind of data that shows the gap. Okay, so those are some ways to make this tieback work in this example. So let's try true and false. So true and false, you know, mitigation activities under the CDBGDR set aside must always have a tie back to Tropical Storm Helene. And the answer is false, because mitigation set aside allows projects to address current or future risk, even without tieback. So again, mitigation set aside activities have different rules, which focuses on addressing current or future risks, even if they do not tie back directly to the disaster. So the project, again, must show that it reduces long-term risk, even if Helene didn't damage that facility. So now we're going to move on to national objectives. Now, every CDBGDR project must meet a national objective. This is a fundamental eligibility requirement set by HUD. There are three main national objectives. You have either the project must meet a low and moderate income benefit, and this is the largest category with 4 ways to qualify, and that includes area benefit, limited clientele, housing, and jobs. Or your project can address a slum and blighted area, which is determined on an area basis or spot basis. Or your project can meet an urgent need, but this is pretty much used less often, but it is still important for disaster recovery, especially when the other categories do not fit. So just think of these as the why behind the project because they explain who benefits and how HUD statutory goals are met. So for today, we'll start by looking at them at a high level. Then we'll dig into one in detail with examples of documentation and what applicants need to show for compliance. But now just keep in mind that tieback and national objectives are separate tests in that every project must meet both those requirements. Now, HUD does require that at least 70% of all the CDBG-DR funds benefit low and moderate income persons. So the state is required to ensure that 70% of their expenditures benefit this group. This ensures funds directly support the populations most impacted and with the least resources to recover. The remaining 30% can be used under the other national objectives like the urgent need or addressing a slum and blighted area if justified. But HUD does allow some exceptions and waivers in certain disaster recovery allocations, in case the 70% would limit effective recovery. So in those cases, the percentage could be lowered to like 50% or 55%, but the state would have to justify the need in their action plan. So regardless of exceptions, grantees must document how low and moderate income benefits are being achieved using your data, maps, and beneficiary records. So let's talk about one of the 4 ways to document the low and moderate income national objectives. So when we talk about low and moderate income, one of the ways, again, that we can address this criteria is through documenting low and moderate area benefit. So we're asking, in this case, does this project serve an area where the majority of residents are low and moderate income? So there are 2 ways to show that, and that's by either using HUD's existing data, which also already shows income levels by census area. And if that data doesn't cover the area, a local income survey can be done to show that most households in the service area are low and moderate income. So we'll go into more detail on each of these methods in the upcoming slides. So let's continue with how we determine low mod area eligibility within a service area. So step 1, of course, we first must clearly define our service area. So this includes identifying the nature and scale of the activity. We're looking at the location and accessibility and checking existing public service boundaries. So you also want to look at nearby comparable services and make sure the area is mainly residential and that the whole area will benefit. Support your definition with maps, service zones, or some type of planning study. And then the next step, you want to obtain the HUD approved low and moderate income data. This comes from that HUD's low and moderate income summary data table. We check the census block groups covering the service area to see if more than 50% of residents are low to moderate income. And then we apply step 3 applies when the service area includes like multiple block groups. So you'll need to calculate a weighted average and multiply each block group's low and moderate income percentage by its total population. Add those numbers together, and of course, then divide by the total population to get that weighted average. But the process pretty much ensures that we are accurately documenting and demonstrating eligibility for that for meeting the low and moderate area benefit. So on this slide, we'll continue with how to determine eligibility within a service area under the LMA. So what you see here is an example map from the HUD's mapping tool, GIS tool. The shaded areas represent census block groups or subdivisions that have HUD-approved income data. To determine eligibility, you would locate your service area on the map and then check whether more than 50% of the residents in that area are considered low and moderate income. Now, the tool makes it easier to visually confirm which parts of your county or community qualify under low mod area. And I've also included the link here so you can access HUD's mapping system directly. Now, this slide is a continuation of how we determine eligibility within a service area for the low mod area benefit. The main point here is that the eligibility is tied to the actual neighborhoods or blocks that make up that service area. So it's not just about one street or one building, it's about the area as a whole. So when we define a service area, we need to think about how people in the community actually live and interact, whether it's a subdivision or a group of streets or neighborhood. This pretty much helps us think about how to outline the boundaries of the service area and then compare it to HUD's data to see if more than 50% of the residents are low and moderate income. So, what if HUD's published data, low mod income data for my project service area is borderline or possible mismatch with current local conditions? Can we challenge it? You may be asking yourself that question. But pretty much HUD standard is a hard threshold, but there are other methods that you can use, which is the HUD compliant income survey, or you can redefine the service area or just use other qualifying national objectives that may be a better option. And so the income survey method, and so as I mentioned, this is the other way of if the low mod area map does not, or that data is not a good fit, it's not, you don't feel that it's accurate to your current local condition. The income surveys can be used to collect household information when that HUD provided data is not available or not sufficient to demonstrate your low mod income benefit. So the survey typically asks about household size, your occupation, monthly income ranges, and so forth. But if at least 51% of the respondents fall within the low moderate income threshold, then the service area, can qualify under low mod area benefit by using these surveys. But it's just important that surveys are conducted consistently. And again, it has to cover that full service area and document the methodology and results for HUD monitoring purposes. So income surveys are not always required, but if the service area aligns with a block group, again, that is at least 51% low moderate income, then no survey is needed. Just use the HUD data. Now, if the service area overlaps or if a project is in a newly developed or recently impacted area, then these may be good instances where income survey may be useful to meet the low mod area benefit criteria. But this slide just pretty much highlights the type of projects that normally qualify under the low mod area benefit national objective. So let's do another exercise and in determining low mod area eligibility. In this case, when we talk about service areas, we mean the actual population that will benefit from the project, not just the boundaries of the city or county. So the goal here is to identify the most reasonable area that the project will serve. So in this scenario, the town of Riverbend plans to use CDBGDR funds to replace a deteriorating water line that serves the Oak Hollow neighborhood. The engineer confirms that the line only serves 142 households in Oak Hollow. You check the HUD's low mod income data and you find that block group 1 census tract has 48% low mod income, and the entire town of Riverbend has 53% low mod income. So of these, which is the correct service area to use for determining low mod area eligibility? Is it A, the entire town of Riverbend because it's over 51% low mod income? Or is it B, the Oak Hollow neighborhood because that's the actual service area? C, the county where Riverbend is located? Or D, any area that gets us over 51% low mod income? And so in this case, the correct answer is B, the Oak Hollow neighborhood. Again, the service area for low mod area eligibility is the area that will actually be served by the project or activity. So this may not always align with jurisdiction boundaries, like within the city limits or county lines, but instead it should reflect the true service delivery area. So, let me emphasize that choosing the wrong service area could make an otherwise eligible project ineligible in this case. Now, we just spoke on how to document eligibility for a low mod area. Now let's talk about documenting low mod clientele. So the low mod clientele LMC activities benefit pretty much a specific group of people rather than the entire population in the area. So to qualify, at least 51% of beneficiaries must be low moderate income persons. So these activities often serve groups that are presumed by HUD to be primarily low mod income. So when we talk about the limited clientele activities, one important shortcut that HUD allows is the concept of presumed benefit groups. So this means that instead of like collecting income information from each person, so HUD assumes that certain groups of people by nature mostly low to moderate income. So if a project or service is designed mainly to serve these groups, then the project can qualify under the LMC category. And of course, the presumed benefit groups include like your abused children, elderly persons, severely disabled, homeless persons, and so on. But just remember that this doesn't mean that any project serving these groups qualifies. The activity still has to be targeted to that group and not just open to the general public. For example, if you have a health clinic serving the general population, that wouldn't qualify under presumed benefit unless it was specifically designed for one of the groups, like a clinic for persons living with HIV or AIDS. So this type of criteria helps cut down on certain paperwork, and it just kind of makes it easier to qualify projects that clearly, benefit those vulnerable populations. Now, when we talk about low mod clientele, limited clientele, HUD does have very specific rules when an activity can qualify under this national objective. So to make sure the benefit really goes to the low and moderate income persons, there are, several tests. So again, that is through presumed benefit groups, or you can whether are automatically considered to be low moderate income, or through income documentation. If your activity serves a group that is not presumed, and you need to show that at least 51% of the participants are low and moderate income. So let's walk through how to determine eligibility under the low mod limited clientele national objective. So step one, again, just identify the activity. You'll need to just describe what the project will do, confirm it benefits either a specific group of people and not the general public. The next step is just check HUD's presumed benefit groups. If your activity exclusively serves one of these groups, such as the seniors or persons experiencing homelessness or severely disabled adults, then the project automatically qualifies as low-mod clientele. But in that case, um, you don't need to complete the next steps. But if not, then you move on to the next step where you define the service population and just be clear about exactly who's receiving the benefit, and define the project, it must be defined and specific to that group, um, such as eligible residents or enrolled participants. And then the final step is just reviewing and verifying the income limits. And I included that link at the end of the presentation where you can determine if that group falls within those income limit criteria. So you'll use the HUD's published income limits for your county, and you need to ensure that at least 51% of your beneficiaries are at or below that threshold, low income threshold. So these steps just kind of walk you through and help you document and confirm that your activity meets the low-mod clientele national objective. And again, when we talk about determining eligibility, we're really just asking, how do we prove that the project is mainly helping people who are low and moderate income? So when you think about the project, just ask yourself, who's exactly being served? Can we show that most of them meet HUD's income definition? That's the key to proving eligibility under the low mod clientele test. And these are just examples of the project type that is designed to benefit, a specific group of people, not the general public. So to qualify, again, you just need to show that at least 51% of the people are low and moderate income. But these are just examples of how this criteria aligns with a certain project category, such as like rehabilitation of single family housing, or a training center for severely disabled, or public facilities mainly used by low and moderate income clientele. And these are, again, just examples. But one important thing to remember is that there are two different paths. If your project serves one of HUD's presumed benefit groups, you just need to show your activity is limited to that group. But if you're serving that broader population, then you'll need to eventually, during your project operation, obtain intake forms and verify and prove that at least your 51% of the participants meet the low and moderate income threshold. So knowing which path applies will save you a lot of time later when you're preparing your application or audit documentation. Now let's talk about another method up under the low mod income criteria that you can use to document that you meet this criteria, and that is through low mod housing benefit. So under low mod housing, the focus is on housing units, not just individuals. So the key is the assisted housing must be occupied by low and moderate income households. So this could be, through your single family home, multifamily apartments, or rental units. For example, if CDBG-DR funds were used to rehabilitate or rebuild a home, that home must be occupied by a low mod income household after completion. Or if a multifamily building is repaired, a certain percentage of those units must go to low and moderate income tenants. So when we're documenting low mod housing, we're looking at housing application, tenant incomes, ownership record to prove household meets the income requirements. The benefit is tied to the housing unit itself, as long as the occupants of that housing unit are low and moderate income, and that helps the activity qualify. Now, if we were to apply the Lomond housing test, we need to show that the housing activity will benefit the LMI household. So that means the units, again, must be occupied by LMI families, whether it's rehab or replacement housing. The key is that the benefit goes directly to that household, not just the neighborhood. So documentation is usually at the household level, again, like using income certification forms or other records that show that they meet that criteria. And this is, of course, different, obviously, from meeting the low mod area benefit, which is about serving an area. With low mod housing, we're zeroing in on the families who will live in those homes. So, the basic steps that you would use to apply this criteria to low mod housing, you just identify the activity, make sure that that project actually involves permanent housing units. That could be new construction, acquisition, or even replacement housing after disaster. Confirm who will occupy the units. If it's owner occupied, the homeowner has to meet the HUD's low mod income limits. If it's rental, again, at least 51% of the units must be occupied by low mod income households. Just review and verify income. And that's again where you check the HUD's income limits, for your area. And again, those are published every year, usually effective in the spring. And that's the data you'll use to confirm the households qualify. So overall, it's just about confirming the project. It's housing, confirming who lives there, and then verifying the income against the HUD's income limits. And these are just examples of activities where the low mod housing national objective applies, meaning, again, that it directly benefits low mod income households through housing. And that they're occupied by eligible households. But the key point is that HUD requires documentation to prove the activity benefits those households. So this ensures compliance, and it just prepares counties for state review when they later apply for CDBGDR funds. So let's try another exercise, but this is to test your understanding of the low mod housing national objective. In this activity, you'll review this scenario and we'll determine whether or not it qualifies under low mod housing. So when applying for CDBGDR funding for a 30-unit multifamily rental project, the project must demonstrate in the application that at least 51% of the units will be occupied by low and moderate income households at project completion. So they can satisfy this requirement by providing a proposed marketing and tenant selection plan targeting low mod income households and a written commitment to monitor and report low mod income occupancy for the affordability period. So is this true or false? And if you answer true, then you are correct. So again, think about the key eligibility factors, who the beneficiaries are, whether at least 51% of assisted units are occupied by low and moderate income households, and how the documentation would need to support, that eligibility. Now let's talk about when and how you would use this last category under the low mod income national objective, and that is meeting the low mod income job creation or retention documentation towards your eligible project. So the low mod job criteria applies when a project creates or retains permanent jobs and at least And here's that magic percentage again, 51% of those jobs go to low and moderate income persons. So documentation can include new hiring intake forms, household income certifications, job descriptions, that do not require advanced skills or education. But the jobs must be available to low mod income persons and advertised through accessible channels. But this criteria is especially useful for like your economic development activities. So like supporting, commercial rehab or something like that after a disaster. But this method pretty much ensures that funding is tied directly to economic recovery for the community's most vulnerable workers. Now let's step through some of the key questions you need to ask when determining if your project can qualify under the low mod job category. So first, you need to ask, does the project create or retain permanent jobs, whether it's temporary or seasonal position? Those that won't necessarily qualify, but if it's there to create or retain permanent jobs, then you can move to the next step, which will determine if at least 51% of those jobs are held or made available to low and moderate income. So first, determine if the project create or retain permanent jobs. Then second, determine if at least 51% of those jobs will be held by low and moderate income persons. Then determine if the jobs are full-time equivalent positions, not just part-time hours, pieced together. Then next, you want to determine if the jobs are being retained rather than created. And, can the business pretty much demonstrate that the jobs will be lost without the CDBG-DR assistance? And then next, are the jobs being advertised and recruited in a way that is accessible to low mod income persons? So these are pretty much like your core eligibility questions you'll need to document up front. So if you can answer these, then your project is, pretty much going to be on the right track for meeting that low mod job compliance. And again, just to walk you through the steps of determining that eligibility, you want to define the job impact, identify the number of jobs that you're going to either create or retain as a result of the project. And again, it's important that you clearly document how that project leads directly to those jobs. Then you want to assess your low mod income percentage, gather, the income information. For retained jobs, you want to collect data from current employees. For newly created jobs, anticipate the income levels of those expected to be hired, but compare that data against HUD's income limits, for your service area to confirm eligibility. And then next, you want to determine if the jobs are made available to low mod income persons. So a job can qualify even if it's not filled by a low mod income individual, as long as it was realistically available to them. So that means the job requires no special skills, beyond reasonable training, and it's advertised in a way that's accessible to the low mod income individuals. So as long as the position was open and attainable and reachable for the low mod income applicants from the start, it can still be counted toward the low mod job requirement. And then again, when documenting, one of the most common pitfalls is not linking jobs directly to the project. HUD again requires clear and direct connection between the CDBG-DR funded activity and the jobs created or retained. But another frequent issue when it comes to common pitfalls is inadequate documentation of income levels. The employers must collect verifiable information on household income to demonstrate that the 51% of jobs, are held by or made available to low mod income persons. And then another pitfall is, just assuming that availability equals compliance. Simply just stating that jobs are open to the public, it's not enough. They must be realistically attainable by low mod individuals with no unreasonable skill or education requirement. And then finally, another common pitfall is just failure to document recruitment and outreach. Advertising, only in a narrow or inaccessible way can pretty much disqualify jobs from counting towards low mod job criteria. So HUD expects evidence of outreach to workforce centers, things like going through local postings and, just throughout low mod income communities. And this slide just highlights some of the common types of projects that can qualify under the low mod income jobs national objectives. But the key point is that it's not just about the physical activity, like preparing a site, redeveloping building, or improving infrastructure, but it's also about showing how these activities directly lead to job creation or retention. And again, that at least 51% of those jobs go to your low and moderate income persons. So let me reiterate for record keeping requirements. HUD requires proof that jobs were actually created or retained. You must show that at least 51% of the jobs benefit low mod income persons, and employers need to maintain, certain records to verify eligibility. So those records should also include advertising and recruitment methods to confirm that low mod income persons had a fair chance to apply. So if it's the way HUD sees it, if it's not documented, then it didn't happen. So in this low mod job exercise, a local government is applying for CDBG-DR funds to help a manufacturer expand operations, creating 12 new full-time jobs. To meet the low mod job requirement, the application must show that A, all 12 jobs will be filled before construction begins. B, at least 51% of the jobs will be held by or made available to low mod income persons. Or C, all jobs must be filled by residents of the county where the business is located. Or D, job postings will only be shared with existing employees. So, for meeting the low mod job eligibility, which of these would meet that requirement? And the answer, of course, is B. Again, you must document how and at least 51% of the jobs are created or retained by your low mod income employees. Now we're going to move on. We're almost through the national objectives. I know it's a lot, but just hang in there. As I mentioned earlier, the low mod income national objective is one that most projects will use, especially since HUD requires at least 70% of the CDBG-DR funds benefit low mod income households. But there are other pathways to meet the national objective, and one of these is addressing slum and blight. So projects under this objective focus on deteriorated areas or structures that meet local or state definitions of slum and blight. So there are two ways this can be applied. One way is through area basis, and this is where a project addresses conditions of slum and blight across a broader area. So in disaster recovery, this means that the area must show damage or deterioration linked back to the tropical storm Helene. For spot basis, this is where the project targets a single structure or property. So in this case, the projects must be located within a HUD identified or state identified most impacted and distressed area. But this national objective, the slum and blight national objectives, is less common than the low mod income criteria, but it's still important to understand when communities are dealing with storm damage like downtowns or commercial corridors or severely deteriorated structures that pose a risk to recovery. So this criteria can still be, like I said, alternative use if you can't meet the low mod income and you have the documentation to qualify your project under this criteria. Now, here we're breaking down when to use area basis versus spot basis. So area basis basically applies when the locality officially designates a slum and blight area and the project addresses broad conditions like substandard buildings or a failing infrastructure. So, and then spot basis is used for a single property with clear health or safety threats. Like a collapsing building, or if it has severe code violations or just any other hazardous, conditions. And the activity must directly fix that issue, whether through clearance, hazard removal, or preservation. So just think of an area as addressing larger zones and spot as addressing one specific property. Now, to qualify under slum and blight area basis, the locality again must officially designate the area as slum and blighted. The designation should be supported by documentation such as local resolutions or ordinance or planning studies. But HUD does require that at least 25% of the properties in that area exhibit blight conditions, like substandard buildings or infrastructure decay, code violations, and so forth. But the activities must directly address the conditions that contribute to the blight, such as clearance, rehabilitation, or infrastructure improvements. And the key point is that this determination ensures funds target areas with documented deterioration and that the project helps eliminate, those conditions. Now, to document, again, the area basis, again, this is different from the spot basis because we're looking at a broader section of the community. The documentation must show that the locality has officially designated the area as slum and blighted, and the conditions exist across the area, not just a single site. So that, again, the typical documentation includes your maps and boundaries, like your surveys, showing deteriorated structures or failing infrastructure, and again, a resolution or ordinance adopted by the local governing body. And the main point is you just demonstrate that the problems are area wide and that the proposed activities will help address or prevent future decline. Now, the slum and blight spot basis determination, let's talk about that. And this applies when a single property or a very limited number of structures show clear slum or blight conditions. So the goal again is to address an isolated hazard or unsafe condition that threatens health, safety, or community revitalization. So when documenting slum or blight on a spot basis, we need to be very specific. And the focus is always on the individual property or parcel, not the surrounding area. The documentation should clearly establish the hazardous or blighted condition of that site, such as through inspection reports. So we could use photographs or code enforcement records, but the scope of work must be limited only to correcting that condition. So, like, for example, demolition clearance or hazard abatement or preservation whenever that's feasible. And then finally, the file must include a statement of what the site will be used afterward, since HUD's change of use requirements may apply if the land is redeveloped in the future. And here's just some examples where slum and blight documentation might apply. On an area basis, we could be talking about an entire downtown block or neighborhood that shows widespread deterioration, like vacant or unsafe structures that need facade improvements or demolition. On a spot basis, it could be, again, one specific property that presents a clear health or safety risk, such as building with structural hazards or code violations. But again, the key is that the activity is tied directly to removing those blighting conditions so that it, no longer poses a threat to that community. And so I just want to add also that slum and blight activities require, careful documentation. There's a lot of documentation required for this national objective. And so careful documentation to justify eligibility is important, and just, keep clear records of the conditions and repairs, and use HUD guidance and the state resources to just make sure, ensure consistency and compliance. Now, the last national objective that we'll discuss is urgent need. This is the, this national objective applies when your community must address like a serious or immediate threat to health and the safety of your residents, such as post-disaster recovery situations. Now you're probably, wondering, how could my project qualify in meeting this national objective? And so to do so, your project must directly address a serious and immediate threat to health or welfare, be a problem of recent origin or urgency, and show that no other financial resources are available to meet the need. And the steps that you would take to determine if your project meets the urgent need criteria is you'll start by first, naming the problem, whether it's contaminated water, landslide risk, or unsafe building. Regardless, this has to be backed up with clear evidence like reports, inspections, photos. Then you'll need to show when the condition became critical. So HUD requires proof that this occurred within the last 18 months. So dating the problem is key. Then you want to prove that the seriousness by getting experts, to put it in writing, like an engineer, public health official, or fire marshal. Basically, they need to put it in writing to confirm that this is a real threat to health and safety. And then finally, we must demonstrate that no other funds are available. That means showing, things like FEMA denials or other like USDA or state ineligibility, or that local budgets simply, just can't cover the project. So now let's look at some, real examples of activities that can be funded under the urgent need national objectives. So, these are projects where there's pretty much a clear immediate threat to public health or safety, and where no other funding is available. For instance, like repairing a water or sewer system has failed and pose a contamination risk is one example. Another would be like stabilizing a landslide or repairing critical drainage infrastructure to prevent flooding that could damage homes or businesses. But urgent need can also apply to demolition of unsafe buildings that endanger the public, or emergency repairs to roads and bridges that have been compromised, and that's critical for evacuation or emergency access. The key point is that these activities must directly address a serious and immediate threat to the community, be tied to the timing of the event, and clearly demonstrate that no other resources cannot fully cover the need. So that's what make it a strong fit for CDBG-DR funding under this objective. But let's talk about the problems of not documenting urgent need properly. And one of the common pitfall is failing to provide written evidence that the condition poses a serious and immediate threat to the health and welfare of the community. So it's not enough to assume the connection. HUD requires documentation. Um, Another mistake is using old data or vague statements that don't tie the condition directly to the disaster. The documentation has to show what the need is recent and directly related. Sometimes applicants forget to show that other financial resources are available, and HUD wants proof that these sources couldn't reasonably address the problem. And then finally, a big pitfall is thinking you only need to meet part of the criteria. So for urgent need, every requirement must be satisfied and documented, or the project risk being found ineligible later. So as we close this section off, let's step back and recap how the different project types align with the HUD's national objectives. And just remember that every CDBG-DR project must tie to at least one national objective. And the state's action plan has been structured to guide applicants toward, the best fit. So for instance, for housing, multifamily rental projects will fall under low mod income housing. Again, where at least 51% of the units must be occupied by low and moderate income household. The same thing goes for workforce housing. For owners, that aligns also with low mod income housing. This is when the owner must meet the income limits. In special cases, though, urgent need may apply if there's a disaster related safety risk. Now, for community infrastructure, such as your water, sewer, road systems, the most common national objective that is used is the low mod area benefit. When the service area is at least 51% low mod households. Now, if this infrastructure directly supports a housing development, it may qualify under low mod income housing. So, in cases of critical failure, like designated conditions, these projects could also be eligible under urgent need or slum and blight, or even jobs. But for economic revitalization activities, such as site preparation or commercial rehab, um, the state's plan looks to ensure benefits flow to low mod income communities. So these projects can meet the low mod income area benefit if they clearly serve a qualifying area, or low mod income jobs if new or retained jobs benefit low and moderate income individuals. So they can also qualify under slum and blight if you're again eliminating deteriorated conditions, or your project can meet an urgent need. Your economic development project can meet an urgent need when it's tied to post-disaster economic recovery. But the key takeaway is that the action plan isn't a one size fits all. It's structured to help counties and applicants connect project types with the most appropriate national objective. So that way we can maximize flexibility, and while we're still meeting HUD's compliance requirements.